The National Continence Helpline is a resource that allows people to call in if they have bladder or bowel issues. The helpline is a free, anonymous and confidential service, and it's staffed by continence nurse advisors, nurses who have special expertise in the management of bladder and bowel issues. 4.8 million Australians suffer from some bladder or bowel health issue. That's 1 in 4 Australians. The nurses on the helpline can provide people with instruction and advice on the telephone. They can also provide them with leaflets and other educational material that can be posted to them. These materials are all free and they're readily available. Prolapse is very common. Most women who have had a baby have some sort of prolapse, but fortunately most women who have a prolapse don't have any symptoms and therefore don't even know that they have a prolapse. There are 3 main types of prolapse. There is the front wall of the vagina prolapse that gives women bladder symptoms. There's the back wall of the vagina prolapse, which gives women bowel symptoms, and there's also the uterine prolapse. Even if a woman has had a hysterectomy where the uterus has been removed, she can still have a prolapse. Women report prolapse in lots of different ways. Generally though, they will come to us reporting a lump or a bulge in the vagina that's causing them some discomfort. They know that that's not normal and that they usually come to tell their doctor or a nurse about that. Prolapse often affects people's bladder. They will often come to us because they have difficulty passing their urine. They may feel they haven't emptied their bladder well. They may have recurrent urinary tract infections. Sometimes women come to us and they say they have urinary urgency and frequency. They need to go to the toilet in a big hurry and sometimes don't make it and have an accident in their pants. They're the most common bladder symptoms. Some women tell us that they have bowel problems as well. They may have trouble emptying their bowel and sometimes even have to apply pressure down below to help empty their bowel if they have a large bowel prolapse. They may experience pain with intercourse. They may experience reduced vaginal sensation, and this may cause them to avoid sexual intercourse altogether. If you experience any of the symptoms that we've talked about, either bladder symptoms, bowel symptoms, or symptoms that you encounter with sexual intercourse, you should talk to your doctor about these things. In the first instance, we'd recommend that you see a specialist physiotherapist or continence nurse advisor for a series of pelvic floor exercises. These exercises can really help to manage the symptoms of prolapse. The helpline nurses have a directory of services that allows them to link women with local clinicians, such as physiotherapists or continence nurse advisors. Another way of managing vaginal prolapse is to use a intravaginal pessary. Silicone pessary can be placed into the vagina to manage the symptoms that the prolapse is causing. Pessaries can be used as a short-term treatment, for instance while a woman waits for surgery, or as a long-term alternative to surgery. Pessaries are simple devices, but they might not suit every woman that has a prolapse. There are many different types of surgery for prolapse, and the operation done will depend on which part of the vagina is prolapsing and which symptoms that's causing. If a woman does choose to have surgery, the time that she requires to have off work will depend a lot on what sort of surgery she's had and what sort of job she does. Time that the woman has off work is very important because it's the time that allows the tissues to heal. Any pressure caused by lifting, high impact exercise or straining can affect the newly repaired tissues. If a woman is prone to constipation, she should make sure that her stools are soft and that she's not straining on the toilet. So if you feel that you have any concern about anything that we've discussed here today, you should discuss these concerns with your GP.